called Unpaid Care in Domestic Work as a Cause and Consequence of Gender Inequality. Her work focuses on the intersection of care and inequality, linking national to global feminist research and policy advocacy to shift norms and policies around unpaid care work. She has worked on issues of women's economic justice and gender equality for over a decade with Oxfam, UNICEF, and the Equality Institute, and also the Australian government. Our second speaker is Diya Dutta. Diya is a research manager at Oxfam India. She has been leading the inequality research work at Oxfam for the past 3 years. She has contributed to Oxfam India's Inequality Report, which I can absolutely recommend. It's a brilliant report for 2019, and Oxfam India Inequality Report on women's backs. She has been working on the issue of unpaid work for over a decade and has been a researcher for more than 15 years. Diya has a PhD from Jawaharlal Nehru University, New Delhi, and an MPhil from Oxford University, UK. Lucia Rost is a research manager at Plan International. She recently completed her PhD at the Oxford University Department of International Development. Her research interests are in gender, children, and development. She has worked on several international development projects, including work with Oxfam, Oxford Policy Management, and UNICEF. The next speaker would be Jayanthi Lingham, who is a postdoctoral research fellow at WICID, University of Warwick. She has been working on a Monash-Warwick Alliance-funded project, Inclusive Economies, Enduring Peace, the Transformative Role of Social Reproduction, which looks at how women's paid and unpaid labor is affected by conflict. Her research is at the intersections of feminist conflict studies and feminist political economy. Her PhD, completed at SOAS in 2019, examined women's working lives in post-war Sri Lanka. And our final presenter is Fiorella Picchioni, who is a research fellow in gender and diversity in food systems at the Natural Resources Institute, University of Greenwich. Her interdisciplinary research is positioned at the intersection of agriculture, economics, of food and nutrition in the Global South. Her academic practice is informed by mixed method approaches and primary data collection. Fiorella's areas of study include food and nutrition security, agricultural seasonality, nutrition impacts of food price crises, intra-household labor dynamics, and work intensity. She has field experience in Ghana, India, and Indonesia. All presenters, each speaker has been asked to address the following questions. What was your research study context and what are the key themes you would be addressing? What methodology did you develop or pilot and why did you choose this approach? How did you operationalize the method? What benefits and challenges did you encounter? How could the methodology be adapted or has been adapted in the context of COVID-19 pandemic? And what are the lessons learned around research design, uptake, and/or advocacy? After the panelists have spoken, we have the great honor of having Nancy Folbre to provide comments and her thoughts on the presentations. She doesn't need an introduction to this audience, but still. Nancy Folbre is the Professor Emerita of Economics at the University of Massachusetts Amherst, where she is also director of the program on gender and care work. Her research explores the interface between political economy and feminist theory, with a particular emphasis on the value of unpaid care work. In addition to numerous articles published in academic journals, she is the editor for Love and Money, Care Work in the US, and The Invisible Heart, Economics and Family Values, which I think all of us have read. Her current writing on political economy of care provision can be seen on her blog, Care Talk, and I would really encourage you to do that because I went and it's so much interesting work that you have put there, Nancy. Thank you very much. So each of the panelists will share details of this new methodology that they have used. And after Professor Folbre's remarks, we will have about 30 minutes of audience Q&A. So without much ado, let's have Amber Parkes and Diya Dutta to provide an overview of the Oxfam Household Care Survey and its adaptation, uptake, and advocacy in the context of India. Over to you.
Thank you so much, Shirin, and good afternoon, everyone. So my colleague Diya Dutta and I are going to speak today about the Household Care Survey methodology, as Shirin just mentioned. So Oxfam developed this methodology over the last 6 years, together with our partners in the Women's Economic Empowerment and Care, or We Care initiative, which we've been implementing since 2013. Also, just to mention, this has been with the help of Lucia Rost, who's also speaking today about a different methodology. And the Household Care Survey really grew out of a need for a research tool to understand the impact of our interventions, but also to build evidence to influence policy changes on unpaid care work. This has been mainly across Africa and Asia, but also in other parts of the world. So just to flag as well that we now have this as a toolkit for download on our website, and really encourage others to use it and let us know how you go. So some of the key features of the Household Care Survey. Yeah, great, thank you. So it's a quantitative methodology to understand how women, men, and children are spending their time, what the main factors are that are affecting people's care responsibilities, and who's providing that care. And our approach to time use is really in line with international standards, but as it's a multi-purpose survey, it really goes beyond just looking at time use and really tries to understand what are the key factors that have an impact on it, especially for women. And significant analysis is possible with this tool because the survey combines time use along with associated factors such as access to public services, access to infrastructure, access to time and labor saving equipment, and social norms. And our experience in We Care has really been that care becomes a compelling issue to decision makers when it's correlated with other adverse outcomes that they care about, such as children not studying, or injury and illness, or violence against women, or women lacking the time for paid work. So in the Household Care Survey, we therefore ask about children being left alone, about injury and illness due to household tasks, about acceptability of violence, etc. And some of the innovative components of the Household Care Survey compared to traditional time use surveys are that it measures supervisory care, and this is of course learning from the work of Nancy Folbre and others. It looks at social norms, as I mentioned, as well as women's health and well-being, and includes children's care hours as well. In the toolkit, we've also now included some optional modules, for example, on climate change and the pandemic and other crises. And it can be used as a baseline or to evaluate the impact of a specific policy or intervention over time to really tell a story. Next slide, thanks. Great, so in terms of the actual measurement itself, we use a 24-hour recall designed for adults. And then we've constructed 2 key care work indicators. The first being primary care, for hours spent on care as a primary activity, and the second one being any care, for hours spent on care either as a primary, secondary, or supervision activity. And this any care variable is really important to give visibility to the true dimension of unpaid care and domestic work in women and girls' lives. It's been really important for our advocacy. We interview male and female heads of households, and for children, we collect data directly from them using a stylized survey tool, which you can see up there on the right. Next slide, thanks. Okay, so in terms of what we're measuring, the Household Care Survey analysis is organized around 8 propositions or hypotheses about possible factors that influence unpaid care and domestic work. So it looks at which factors have statistically significant relationships with time use patterns. And these 8 propositions were developed following a comprehensive literature review and considering both the priorities that we wanted to explore and the evidence available in this literature. So some of the things that we are exploring, some of the factors, for example, as I mentioned, are access to public services, infrastructure and time and labor saving equipment, but also about men and women's perceptions about the value of unpaid care and domestic work and how skilled or not that they perceive it to be. Also around women's status in the household and social norms, as I mentioned as well. I'll pause there and hand over to Diya.
Thanks, Amber, and a very warm welcome to everyone present here. Can you move to the next slide, please? Yeah, thanks. Okay, so I'm going to talk about how we adapted the household care survey tool to the Indian context. But before I do that, I'd like to just speak a little bit about the background behind which we commissioned this particular piece of research. The household care survey in India was conducted in the year of 2018, which was more than 20 years since the last time use survey data was released by the government of India. And it was another 2 years before the latest time use survey data was released latter half of last year. So it was very timely and topical at the time that we did it. We, of course, because of constraints of time, human resources and budget, we focused on the Oxfam India focus states in North and East and Central India. However, it was extremely helpful, and I will talk about how we've been able to use it as a useful advocacy tool later on. So in this slide, you will see how we adapted the household care survey tool to the Indian context. And specifically, for example, the question of migration, that in a lot of cases in India, the men migrate to the urban cities for work, whereas the women stay back in villages looking after the household. And that has severe implications in terms of the distribution of household care work, the burden of household care work, and how much support on lack of the same women have. So therefore, we introduce questions around migration and marital status, which also indicate on the household structure of those that were interviewed. Then, of course, we included questions around madrasa education for young Muslim boys and girls. We conducted this survey amongst the marginalized populations in India, which is the Dalits, the tribals, and the Muslims. So we included religious questions around tribals and Muslims. Caste was an important factor in India, of course, and we realized that care-saving, labor-saving devices, services, and practices differ from caste to caste and subcaste to subcaste. In India, there is the poverty line, and populations are divided between those who are below the poverty line and those who are above the poverty line. So we introduced the indicator on economic status of below poverty line and above poverty line. Under 24-hour recall, we introduced very specific unpaid labor that women perform, for example, cow dung cake making and cattle rearing. And then the most important part was that in India, the government of India has introduced specific schemes which are meant to reduce the burden of unpaid care work on women. So we introduced targeted questions around those government schemes, such as pipe drinking water and the cooking gas scheme, which is also called the Ujjwala scheme. Now, to also address the issue of time and length of the household care survey, and also the question that Oxfam India has certain stringent regulations about interviewing children. So we removed the childcare module out of the household care survey for the India study. Next slide, please. Now, to supplement the quantitative household care survey, we added a qualitative component, which was conducted in the form of focus group discussions. What you see here are some of the key elements or objectives of conducting the qualitative tool. So we asked more nuanced questions around the 24-hour recall. The second point is that intra-household gender dynamics and power dynamics determine how women's care work is distributed or the lack thereof. So we wanted to understand how that worked out. Then, of course, was the question of, oftentimes what happens is that the burden of care work is so high and so solely on the shoulders of a single woman in the household that she does not get the chance to leave her home and travel to her natal home for some rest and recuperation. So we wanted to try and capture that through the qualitative study. And actually we found that in a lot of cases, women had no substitute to the work that they provided and therefore could never get any rest or leisure time for themselves. Forget about trying to actually travel to their natal villages or homes. Then the next point is about the maximum resistance to redistribution of care between men and women comes from women themselves. And therefore, it was very important to capture the perception of women and men. In fact, in the quantitative survey, we had a section on perceptions about acceptance. What is the acceptance level of violence against women for non-performance or poor performance of unpaid care work? And the acceptance levels were very high. And of 1,000 household survey, 70% of the respondents, 700 respondents were women. So acceptance levels of violence against women for non-performance of unpaid care work is very high among women. So we wanted to understand the nuances of that through this qualitative component. Next slide, please. I want to now talk a little bit about the benefits and challenges. Traditional time use surveys capture a snapshot of the status quo, documenting the problem of heavy and unequal unpaid care work. They don't often provide insights into strategies for change or effective interventions in a particular context. So the benefits of the household care survey is that, for example, in India, we were able to show that in households with access to government drinking water scheme compared to households which don't, women spend on average an hour more on paid work and 22 minutes less on care work a day. That is a significant finding. Conventional time use surveys don't always capture the extent of unpaid care and domestic work done by women and men. For example, asking men if they did any unpaid care or domestic work yesterday might elicit a negative response, but asking about specific questions makes it more likely to capture the extent and degree of unpaid care work done by men and therefore the burden on women. It, as I mentioned earlier, it turned out to be an extremely useful advocacy tool. Oxfam India is positioned in such a way in India that we don't actually advocate with the government, but we did get a lot of traction working with academics and NGO circles. And since this was published in 2019, I have been presenting the work at several platforms, both within the academic circle and in the NGO circle, talking about both the findings and the methodologies. I've written a lot about this as well. The main challenge is really about the budget, because it's a very extensive survey with an extensive sampling. There are issues of translation. And normally nowadays, of course, we use electronic devices such as the tablet to collect data. But in this particular case, we used the paper format because it was cheaper, and we did not have a very generous budget to administer the survey. So some of the adaptations that one has to make, and related to that is also the question of the length, which is that the original survey tool is about 1.5 hours long, but women are, women are of course time poor and they have to juggle a lot of work. So we curtailed it down to 45 minutes. Amber, over to you.
That's fine. Thanks, Diya. I won't speak as we're over, but thanks very much.
I'm so sorry, because the whole point of these things should be to be able to talk through things and issues, but we are constrained with time. I'm really sorry to have interrupted you, Diya, as well, but let's move on to Lucia Rost, who will now provide, hopefully in 10 minutes, an overview of the spot phone call methodology that she has used to measure gender time in northern Uganda. Over to you, Lucia.
Hi, thanks very much. Thanks very much for having me. I'm very excited to be part of this. So as Shirin said, I've recently done a PhD on unpaid care work, and I used the methodology which I called the spot phone calls, which involved calling people at different times of the day and asking them what they were doing. And that's what I'll talk about today. And can you go to the next slide, please? So yeah, my PhD title was Unpaid Care Work and Social Norms, Gender, Generation and Change in Northern Uganda. So I was looking at what adults and children were doing, what they spent their time on, and how this related to social norms. And then I was particularly interested in whether these norms were changing in the post-conflict setting, where a lot of things have been kind of changing. And I used different mixed methods to measure time use. I was working very closely with the We Care team. I used Oxfam's household care survey data. I also conducted a lot of interviews, focus group discussions, participant observation, and I had different rounds of field work. But I felt like I wasn't kind of capturing the longitudinal dimensions as much, especially seasonal differences in time use and especially care work. I also wanted some more in-depth case studies. So this is why I developed the spot phone calls methodology. Next slide, please. So the methodology builds on experience sampling methods and spot visits. So experience sampling methods are methods that use a tech like a device that people carry with them, and then they're reminded by the device to record their time use at different times of the day. And spot visits are more observational methods where people just visit with participants at different times of the day and then write down what these people are doing at a specific point of the day, of time. And I built on these methods, but then I didn't use a device and I didn't visit people. I just called them on their phones and just asked, what are you doing right now? I worked with 4 families and called them for a period of 1 year in 3 seasons. 1 week per season, and during these weeks I called them every day, once a day at different times, so they wouldn't know when I would call the next day. And when I called them, I interviewed all household members aged 8 years and older, so that was an important part of my research, was always to include children as well. I used MTN Web Phone, which is like an online phone service, and it charges local rates. And practically, we worked with 2 phones. So my research assistant helped me with translations, and she had 2 phones, both on speakerphone. And I would call her on one phone, and with the other phone, she would call the participants. And so I could actually talk to the participants as well. So when we called, we always asked, what are you doing at the moment? How long have you been doing this? Where are you? Who are you with? And sometimes also other follow-up questions like, who decided that you do this? How do you feel about it? What else have you done today? What do you think you'll do next? And also a lot of why and kind of probing questions. What worked well? So they were quite cost effective. They didn't involve any traveling. It was mainly just paying my research assistant and the phone charges. And then also we paid participants compensation, some airtime and some products. They didn't take long, so it was usually just 5 to 10 minutes per person, and there wasn't any training required for participants. It was just taking a phone call. They didn't have to use a complicated device or anything like that. And I did capture seasonality. So for example, during the dry season, a lot of women or girls particularly told me that they had to walk much longer now to fetch water. They had to walk like an hour, and that was taking up a lot of their time. I even called a woman once while she was on the way to the borehole, and she said, oh, I've been walking for 45 minutes already, it's really far. I also captured longitudinal dimensions. So it was interesting to see how shocks or kind of events that happened affected time use of different household members differently. For example, one man had an accident, so he couldn't support the family anymore with his carpentry work. And that really affected all the households members differently. So some children were taken out of school. Some of the older girls started doing more income generating work, but the younger children weren't as much affected. So there were these dimensions I could capture with these spot phone calls. And also around looking for work, how there was like a crisis of masculinity, I would say, in this region, and a lot of men struggled to find work. And I could really see how this evolved with particular families. So every time I called, they'd be like, still looking for work, still haven't found anything. So that was interesting to observe it over 3 seasons and how it evolved and how that affected and how the frustration increased as well. And as this already shows, it got more than just time use out of this method. So I also got other dimensions, for example, also about intergenerational conflict. So I asked a woman, so what's your son doing right now? And she was, oh, he's drinking, he's just by the roadside. And then she got very emotional talking about intergenerational changes and things like that. I also felt that the spot phone codes reduced recall bias and social desirability bias, because people didn't have to recall what they'd been doing. They would just ask on the spot, what are you doing right now? And in a way that also meant I felt actually that the spot controls worked best at capturing men's care work, which might have been underreported in some of the other methods, because they didn't find it was kind of socially acceptable to report that they'd actually engaged in care work. So Anam, if you go to the next slide, please. This is an extract from an interview with a man who at first didn't mention any care work, but then it turned out he had actually done quite a bit. What are you doing? I'm just from eating. I'm just under the tree resting. What did you do before? From the garden. I finished up with the latrine. And before was just from bed, went to the garden. But then when I asked who's with you, he said, oh, I'm with my 6-year-old son. I chat and talk with him. Who cooked your lunch? I cooked myself. Who fetched water for the cooking? I went also to the borehole to collect water. And did you also cook for your wife and others, or just for yourself? Oh yeah, I cooked enough food for everyone in the family. So you had actually cooked. So I found that actually with all the men I interviewed, that I found them doing more care work than in the other methods. Next slide, please. And what didn't work well? So we had network issues. We didn't reach everyone every day. Not everyone, most people didn't have access to electricity, so they had to charge their phone somewhere else. And that, sometimes they were switched off. Not everyone in the area owns a phone, which also kind of might just screwed the sample a bit. And for phones were, almost all of them were owned by the men, which meant sometimes I could only talk to the men if they were in the center, they were with their friends, they were away from the family. I couldn't talk to their children and wives. It may have been intrusive, and it may not work in settings where people are in an office, or they can't just take calls all the time. And it was a very small sample. I mean, only 4 families, so it's not very representative. You go to the next slide, please. I think this would work well in COVID-19 context, because it was mainly done remotely. Although for this particular context, it was important to have established contact before. So I had done participant observation and interviews with all the families. They knew me really well, especially for the children as well. And they were very open in the calls, and they even continued calling me after the calls and wanted to tell me more things that had come up. And but I think it would have probably not worked as well if I hadn't known the families. So building trust is important, and also we actually visited the families before each set of call, just to remind them to charge their phones. So that was my research assistant who went to visit them, which might not work if it's only completely done remotely. Yeah, if you want to find out more, I wrote a paper on this method and also a blog post that summarizes the paper. And I've also thought a lot about kind of measuring children's time use, and written a few publications on this as well. Let me know if you have any questions.
Thank you so much, Lucia, and also for keeping to time, which is great, makes my job much easier. So we will obviously have a discussion after everybody has spoken. So I'm sure there'll be a lot of questions. I have a couple of questions for you already. Our next presenter is Jayanthi Lingham, who is going to talk about the Feminist Everyday Observatory Tool, which I and my colleague Jackie True at Monash University have put together as a method to measure women's unpaid labor and depletion through social reproduction in conflict-affected environments. Jayanthi, over to you.
Thank you so much, Shirin, and welcome to everybody. Shirin, you've very nicely introduced the Feminist Everyday Observatory Tool, which saves me a little bit of time. So I'm going to be talking about how we piloted this, which I will abbreviate to FEOT, to look at unpaid care work in situations of post-conflict recovery or conflict-affected environments. Just to recap on what Shirin said, the FEOT is a mixed method analysis of time use developed by Shirin, Rai at WICID and Jackie True at Monash. It expands the study of time use, and it does this through a 3-step observation methodology that also takes into consideration the impacts of space and violence. And we piloted this at the start of last year, just before the pandemic started, in conflict-affected Myanmar and Sri Lanka. So the 3 steps of the FEOT are a pre-observation questionnaire, an observation day, and a post-observation, ideally narrative interview. The initial questionnaire gathers key demographic data about the participant in our household through a half-hour meeting. Then for the observation day, the researcher shadows the participant to understand how she uses her time and what her everyday work involves. And in the post-observation interview, which lasts 1.5 to 2 hours and is carried out as soon as possible after the observation day, the participant answers questions about significant aspects of the observation day and about the wider environment. The method aims to be especially sensitive to context, and this was especially important for us, and I think important for studies that are taking place in complex political, economic, and social conditions, where those conditions might overdetermine people's everyday lives. And the other thing that I really want to emphasize about the method is that it takes seriously women's agency, their voices and their potential. So it doesn't only measure their time use, but it also documents what they feel about their time use and about the context. So we used the FIOT to carry out a study funded by Monash and Warwick, looking at how women's paid and unpaid labour is affected by conditions of conflict and conflict recovery. And we carried out this study with households affected by conflict and displacement in Myanmar and Sri Lanka. We carried it out with 19 women within 19 households in total between January and March 2020. I did the fieldwork in Sri Lanka, and my colleague Melissa Johnston, then at Monash University, now at Melbourne, did the fieldwork in Myanmar, and we worked very closely with in-country fieldwork partners. And our study asked, how do conditions of conflict and conflict recovery affect women's social reproductive labour? I'm going to touch just very quickly on the core concepts. So we talk about social reproduction and social reproductive work rather than only care or domestic work. And we use Ryan Hoskin's definition here. Social reproductive work is the variety of socially necessary work that provides the means to maintain and reproduce the population. So of course that includes unpaid work in the home and care work, but it also covers the work done to maintain and reproduce communities, such as voluntary work or political organising. And we were looking at what work is carried out and how. And then secondly, the concept of depletion through social reproduction, which Shirin touched on at the beginning of this. The concept of depletion, again, developed by Rai et al. In 2014, is one that we use to account for the costs of doing social reproduction. So depletion occurs when human outflows, so time doing social reproductive labour, exceed inflows, such as medical care, support networks, and that carries that social reproductive work over a threshold of sustainability and makes it harmful for those engaged in it. So we were asking, what are the costs of this work and for whom? And then for advocacy, we wanted to think about what needs to be done by actors to reverse depletion through social reproduction in conflict-affected environments. I'm going to talk about the second two stages of the FIOT specifically, so the observation day and the post-observation interview. So just to recap, the observation day consists of the researcher shadowing the participant for the day, which can be up to 16 hours, documenting her time use every 15 minutes in a time use diary and noting observations about the context. And photos of the social reproductive work might be taken with informed consent of the participant. And you can see from this time use diary that the observation day really allowed us to document in detail what social reproductive work is being carried out and how. And it really generated very rich time use data. So the extent and the impact of carrying out multiple forms of social reproductive work. You can see here, the woman was cleaning, she was looking after the child, she was sweeping as well, she was taking the child for a bath. And we could also observe, I think, the blurred lines between paid and unpaid work. So the photo in the bottom right-hand corner is of home farming. So time spent doing home farming was subsistence work, but at the same time, it included packing mushrooms to sell to the neighbours. And being there in person to observe meant that we could observe the nature of the conflict-affected context. This is one participant's home in conflict-affected Sri Lanka. Even though it was 10 years after the end of the war, they still didn't have running water in their house. They were using the water bottles that they'd been given from IDP camps. And the observation day allowed us to document the impact of this lack of facilities on women and their work. And this is actually an extract from the time use diary of another participant in the same location who also didn't have running water in her home. She did both paid and unpaid work for the household, and she was disabled due to war. I'm pausing for a second so you can read it. But the time use diary shows the immense depletion that she was experiencing due to the combined effects of the gender burden of domestic work, the long effects of conflict, disability, and the lack of basic infrastructure. So that's the observation day. Moving on to the post-observation interview. Just to recap, that happens as soon as possible after the observation day. It's about 1.5 hours long, and the participant answers questions about the observation day in the wider context. And during this, in addition to asking about how they felt about the social reproductive work that we'd observed, we could explore the complex context and sensitive topics in more depth. So what this did was it allowed us to triangulate data from the first 2 stages. For example, if things had been observed in those 2 stages but not fully understood, we could now explore them. So to give you an example, this participant was very keen to join the study, but we observed that she was psychologically very depleted during the observation day. And the interview revealed the hidden gender-based violence that was causing immense psychological depletion. This extract allowed us to explore the continuities between conflict and conflict-related depletion even after war has ended. And we were also able to ask about participants' views on their needs, especially around social infrastructure, so the infrastructure to support social reproductive work and the roles of actors in addressing their needs. So I've already touched on the benefits, but just to recap on these, it enables triangulation of findings across different forms of data. So even though there's this very well-defined 3-step research process, we found there were very informative overlaps between all 3 points of data collection. And it generates rich time use data that really takes into account how time use is affected by the space within which participants live, and also by multiple forms of violence. And I would add that that multi-dimensional focus really resonated with the participants in our study. And I've just included 2 quotes from 2 of the participants in Sri Lanka on their views about it. Obviously, there were challenges. The full-day presence of the researcher on the observation day creates risks for the participants and researchers in sensitive environments. So in this study, there were risks of exacerbating and being exposed to the violence by the military and violence within the household. And of course, under conditions of fragility and uncertainty, things suddenly change and crises crop up. And that's the reality. And it did mean we couldn't always stay for the full observation day. And then when we did, for example, and observed a household crisis, our presence did risk being intrusive. And the third thing is that the method is resource intensive. It calls for long working hours and days by researchers. I'm going to talk about 3 lessons learned. First of all, on research design, we learned from necessity, as I just mentioned, that we could actually be quite flexible with the observation day. So when a full day wasn't possible, we were able to collect time use data on the unobserved stages section of the day during the post-observation interview. And this could be formalized into the 3 stages going forward. So the observation could be shorter, for example, and the post-observation interview could start with a section collecting the remaining time use data. All participants could be asked to self-complete a time use survey for the unobserved part of the day. We also learned that researchers need to actively manage the exit from the field, because after spending so much time with participants, it can be quite emotionally destabilizing for them if the researcher then quite abruptly disappears. So there needs to be some follow-up contact, such as phone calls, which is something that we just did. And the third learning relates to the advocacy that comes out of this. We learned that we need to allocate time and resource to sharing these very rich but also sensitive findings in engaging and informative ways for the communities themselves. And one way that we got feedback on one way we could do this is to create research briefs for local activists and policymakers in their local languages, so not just in English. Finally, could the field be used or adapted for use during the current pandemic conditions? There's some obvious operational challenges. So while the pre and post observation interviews could be done via phone or video call, the main challenges would come from needing to adapt the observation day, given the need for social distancing, travel restrictions under lockdown, and the much higher virus transmission risks indoors. But just going back to the lessons already learned from our pilot study, those 3 stages could be adapted to building in time use data in the other 2 stages, especially through a longer narrative interview, which of course can be done via phone or video call. And we think that time use data could also be collected via alternative methods to in-person observation. And one of the things that particularly interests us is the spot phone calls that Lucia just talked about. To conclude, I made the point at the start that the field reveals the dynamics of complex contexts well. Therefore, I do think that for all those challenges, once the necessary adaptations are made, this method actually does have a lot of potential to uncover how the COVID-19 context is affecting women's everyday lives and work. And I'm just sharing some final resources. Thank you very much.
Jayanthi, thank you. That was amazing and very, very sort of well-timed. So again, thank you so much. And our final presenter of a methodology is Fiorella Picchioni, who will provide an overview of using accelerometry, I'm sorry, as a method to measure. I think that might be something that we talk about as to pronunciation of methods. To measure gendered energy expenditure, which I think is fascinating, and time use in rural environments in the global South. So over to you, Fiorella.
Thank you very much, Shireen. So thanks to the organizers for inviting me today. So yes, as it was mentioned, I will be talking about a methodological approach that uses accelerometry devices to estimate physical intensity and energy expenditure of work, including unpaid work. Next, please. So this method was tested and piloted within the New Keys for Old Black Boxes project that was led by Dr. Giacomo Zanello and Professor Srinivasan, who are also attending the webinar today at the University of Reading, and where I was a postdoc between 2017 and 19 when the project was taking place. And we also worked with other universities and research institutes in Ghana, Nepal, India, and the States. Next, please. So the pilot project was aimed at agrarian contexts with low levels of mechanization in agricultural production in 3 different locations: in the southern state of India, Telangana, in Nepal in 2 different districts, in the south district of Chittagong, and in the center the district of Folbre, and in Ghana we worked in the upper west region. It is important to say that the study is positioned within the agri-nutrition literature, which is an interdisciplinary domain which aims at connecting agricultural production, agricultural economics with nutritional science.
Sorry, Fiorella, is it just me? But I can't hear you. I think you're frozen. Maybe if you can turn off the video? Or is that just my...
Differentiate of rural livelihoods. Hello, I think I'm back. Can you hear me?
Yes, we can hear you now.
Oh,
Thank you.
apologies. Yes.
No.
So when did I leave? When did I left you? So okay, let me then maybe repeat maybe the themes were the last bits that you heard. So okay, the study position within the agri-nutrition literature that aims at connecting agriculture economics, agricultural production with nutrition science. And the themes that were explored in the project were intra-household gender differentiated labor allocation and energy expenditure patterns of rural livelihoods, with the overarching aim to capture the intensity of a full range of agricultural tasks, not only those connected to agricultural production, but everything that makes it rural livelihoods. And the final outcome was to be able to link physical activity dimension to the agri-nutrition literature, which mainly focuses on diets and food intakes. So that this is why I will be talking also about food intakes during the presentation. Next slide, please. So we piloted the integration of accelerometry devices with other conventional time use and food intake instruments. So accelerometry devices are basically Fitbits. They work in the same way. They are small, very light objects of the size of the matchbox that can be worn around the waist with an elastic belt. And there are a few pictures here for you to kind of have an idea of how it works. Next, please. So how do accelerometry devices work? So they measure acceleration on 3 different axes: vertical, anterior, posterior, and mediolateral. Then they convert acceleration into movement and in turn convert movement into energy expenditure. We worked with this particular research-graded device called Actigraph, which has a number of desirable characteristics, including being non-intrusive, being rugged, having no screens to change behavior of the participants, and having a long battery life, and importantly also having a contained cost. Next, please. So all these features made accelerometers particularly suitable for studies that aim at capturing habitual activities in the environments where people normally conduct them, and not only in controlled lab environments where where normally this type of studies will take place. In this sense, accelerometry devices were able to provide a more realistic picture of energy expenditure of habitual tasks in agrarian contexts, and also reflect how individuals negotiate physical endurance and fatigue during the day. Next, please. So the aim of the study was to triangulate 3 different sources of information: energy expenditure through accelerometry devices, food consumption through the 24-hour recall food intake survey, and time use information through a 24-hour recall time use survey. With the can go back again. With the objective to examine 2 main issues. The first one is to look at the relationship between energy intake and energy use. And the second one is to create a profile of energy expenditure and energy intensity of all type of work, including unpaid work performed predominantly by women. Next, please. So to be able to do this, we needed to collect all these types of data at the same time. For example, we use this particular data collection protocol. For example, if we started data collection on Monday, our day 1, we would initialize, so we will start the accelerometry devices, that when it starts, it doesn't stop until the researcher doesn't collect it. So once they start, they just keep on registering, recording movement. And we will hand them to participants who will keep them until day 7 and will wear them during the week. In day 1, we will also collect the first round of food intake data. From day 2 to day 7, we will visit participants daily and administer both the time use and food intake questionnaires. And on day 7, we will also collect the devices and download the data. Next, please. So we conducted this protocol with men and women in the same household, normally husband and wives, for a total of 120 participants. And we repeated the 7-day protocol across 4 different non-consecutive weeks to capture seasonality. So we managed to capture the period of land preparation, seeding, intercrop period, and harvesting. So in terms of benefits and challenges, well, the methodology generated a very rich data set and granular detail, including hourly data on types of activities and the associated energy expenditure, and also daily food intakes, to kind of give us a sense of the relationship between these 3 different sources of information. Also, the novelty of the methodology, the fact that we were using a digital tool, meant that communities and participants were very interested in engaging the studies, allowing us to conduct post-study workshops during which participants were invited to look at the visualization of the results and to reflect on the outcomes and ask questions. There were, of course, a set of challenges, some that are linked to the accelerometry devices themselves and others that are connected more to the other instruments that we have used and the study design. So the accelerometry devices tend to underestimate energy expenditure used to carry loads. So if I walk without a backpack or with a heavy backpack, it will not capture a massive difference between the two type of activities. And then also the fact that we were using recall-based instruments such as time use and food intakes, which come with all sorts of limitations. And in particular, the time use, we have all experienced the various limitations previous speakers have mentioned. For example, underestimating men's care work, or difficulties to capture overlapping activities and task switching. That means that we cannot really estimate the energy expenditure of these type of activities. And then the particular research design didn't include the qualitative insights on the psychological dimension of work intensity and fatigue. I can anticipate that in the follow-up projects that we have started to do since the end of this pilot, we address these issues in different ways, and I'm happy to talk about it maybe during the Q&A. Next, please. So in terms of how we adapted methods in times of COVID-19, we were already quite used to work remotely with our partners, with enumerators and coordinators. Clearly, we worked in close communication with our partners and followed their guidelines. And I think it's important to mention that we increased resources for training and data collection during COVID. We have worked already in 2 different sites collecting data on energy expenditure. Clearly, we needed to make our health and safety protocols stricter, including disinfecting devices, changing belts, and all the social distancing and mask wearing. Enumerators were trained were trained online over a long period of time, where we first trained the trainers and then we trained the enumerators, yes, through multiple, basically, activities, so pre-recorded videos, Q&As, practical sessions to test the methodology. We have spent quite a bit of time in stressing the importance of informed consent, which is even more crucial during these moments during the pandemic. Yes, and then also it was quite useful to have established digital platforms and using computer-assisted personal interview techniques to communicate real time with the enumerators and the coordinators, and also offering data monitoring and guidance real time. And then finally, my last slide on lessons and basically reflection for future research. I think that with the growing interest and use of sensor-based and wearable devices in feminist research and different types of research, we need to strengthen the conversation and practices that guarantee the highest level of ethical consideration and guidelines. Secondly, and also linked to this first point, I think the adoption of digital tools need to be positioned in the debate of the scholarship that engages with the politics of research. So who owns the data, who benefits from the data, and how can this particular study design help advance feminist struggles for social justice, and help those at the front line of such battles. Next, please. So I think last slide is just a few resources if you're interested in learning more about our study, and I thank you very much for your attention. Thank you.
Thanks, Fiorella. Sorry about the little hiccup, but I'm sure some of the questions that you raised in your presentation we'll pick up on in the Q&A that is to follow Nancy Folbre's comments. You've been listening, and I'm sure you've got thoughts to share with us. So over to you, Nancy.
Thanks. Let me first say that I'm not pretending to be a citizen of the Nordic countries rather than the US, although that is a very tempting idea. I experienced a breakdown in my social infrastructure with the heating system in my house. So I'm kind of improvising my personal warming system. I can't tell you what a great pleasure it is to hear these papers. And I wish I had more time to tell you the history of 30 years of going to international conferences as a kind of token feminist researcher and being pretty much completely ignored. And so what I love most about this whole genre of research is it's kind of done an end run around the international establishment. And I think it's been a very successful one. So let me just, excuse me, let me just hit on what I see as the strengths and then also make some suggestions that are more about future research than criticisms of the papers presented. First of all, I totally love the methodological creativity and energy of all of these studies. I think they really vindicate the importance of combining quantitative and qualitative research. And I mean, from the spot phone calls to the accelerometer, I think I really like the diversity, comparing different methods, exploring new methods. I think it's really great. I also see, and I think this is somewhat new, more links with academic research and researchers and academic conferences, which I think is really good, presenting at the International Association for Time Use Research, getting journal articles out there. I think that you will be able to recruit a lot of other researchers to your project. So I think this is really great. And I also see a lot of continuing intensifying political relevance to what you're doing. I think it's really changing the public discourse. In today's New York Times, there was a really great op-ed by a Mexican researcher, Viridiana Rios, criticizing the Mexican president for his very sexist policies, and linking to the latest Oxfam study in Spanish on care burdens in Mexico. And it was just so heartening to see it. I think that the message is really reaching a wider audience, which is really great. So here are my suggestions for moving forward. First of all, a point I think I've made in the past, which is I think however useful small scale village level or region level studies are, they would be much more effective if they could be calibrated with more nationally representative data. And I know that's a really hard task to influence national time use surveys, but I think there's now sufficient international pressure to possibly make that happen. I know that UN Women has been really involved in a number of cases of kind of trying to nudge national statistical offices. And I think there's a kind of potential synergy there that I would encourage. I think there's also sort of a younger generation of researchers, many more women now working in national statistical offices, and that creates a kind of opening. Secondly, no one presented any regression results in the presentations today, but the reliance on multiple regression methods was acknowledged, and I think that is an increasingly important methodological issue. And there are quantitative researchers out there actually who have tried to look at new methods like seemingly unrelated regressions and so forth. And I really especially want to shout out the work that Zhao Yuan Dong has done with Chinese national time use data, where she's really, I think, what I would consider her work kind of state of the art in terms of trying to develop more econometric sophistication. I love the rural studies. I think the rural emphasis is helpful because rural infrastructure, both social and physical, is so underdeveloped. But I really feel like the urban informal sector is also really important, and there's a very big population in that urban informal sector. And I think care work is really different in urban areas, partly because there's less opportunity to produce for own consumption, and also because I think childcare is more challenging in the urban sector, there's less kind of neighborhood level supervision and participation of, kind of co-production of childcare and work. And so I think that's would be kind of a really good frontier. Also, we need to leverage this really creative work on developing countries to what's going on in affluent countries, because there's some complementarities there, and affluent countries are really have, as you know, a disproportionate influence on the whole international statistical infrastructure, including the national income accounts, and they are moving towards more recognition of this issue, but I can tell you from personal experience, they remain fairly oblivious to what's going on in the developing world around these issues, and they really need to look for opportunities to give them a really strong push. And I think maybe not so realistic in the past, but I think we're really at a point now where we might be able to make some headway in that direction. And then finally, I think we need to think a little bit more about connections to national income accounts and some methodologies for assigning an economic value to unpaid work in general. And the reason I say this is not that I think a market metric is, the next best thing, the latest and greatest way to make economic arguments. It's because a lot of the policy tools that we use kind of rely on valuation. And the most conspicuous example is poverty lines. Poverty lines are still queued everywhere to money income. And I think this creates some really serious inconsistencies and problems, especially for comparison between rural and urban poverty. So I think, however comforting it is to rely on the metric of hours or calories or reported levels of stress, there is a place for thinking about how unpaid work affects living standards that are still defined predominantly in terms of money expenditures. So onward. I know you all have a lot of collective energy and creativity that you can bring to bear on these, on these cutting edge possibilities. Thanks.
Thank you very much, Nancy. Great agenda for the future for us and research. I particularly want to pick up on two things that you said, which is about urban informal sector. Absolutely, you're quite right. And also, as even in the global South, urbanization is now so, it's such a move to urban centers of production and consumption. So I think that's absolutely right. And the second one is affluent countries, where I think we also need to advocate with our research councils, who still seem to persist in not wanting us to bring those two in the same frame. Right. And in fact, just now, Jayanthi and I have started a new project on COVID and minoritized communities in the UK, and we will be using some of that methodology and hopefully also the others that we have discussed today. Thank you very much indeed. So now we've got about sort of, a little time for Q&A. And we are going to do that in two different ways. Anam is going to open up the chat for everyone now. We just wanted everyone to be focused on the presentations, and that's why I think the chat was closed. So please put your questions into the chat, and I will try and pick it up. And also, if anyone wants to ask a question in person, please put your hand up and we will unmute you. That might take a little time because of the time lag and the technology, but please, we will get there. So do raise your hand and let's begin our conversation. So anyone, yes, I've got questions coming in now. The first one is from Julio Espinoza, who just says, important to challenge. I think this is for Nancy. Important to challenge includes some of them in my work. Very good. And oh, that's just Jayanthi saying, use the reactions button to raise your hand if you don't want to. Shall I make a start and then people can join in? I was really interested in trying to figure out a way in which we can explore the possibility of taking elements of each of the three methodologies presented today. And in particular for me, Fiorella, your work is really interesting because it, of course, allows me to think about depletion through social reproduction in a very quantitative way. And so, but my question to you was, what about the weather? So if you are doing, the pictures you showed, sometimes sort of, if you are out in the heat, does your accelerometer pick up on that? Because you could get much more exhausted in heat than you could, or burn more calories to keep yourself warm, like Nancy is, in the cold, if you don't have clothes, like these wonderful hats that she's wearing. So the weather was one thing, heat and cold, and you talk about physical endurance rather than fatigue. Right? So you might be using up more calories. So could you tell us a little bit more about that? And the same thing is that for depletion, one of the things that we talk about, and Catherine Hoskins is here, I can see her, in our paper, is how, of course, there is the restoration that takes place in the body. So through sleep, as well as through taking rest, so how does your little device measure, or does it not? Either way. So that was my question to you. And then for Amber and Dia, I was thinking sort of, when you talk about the 24-hour recall, now that's quite established element now of research methodology, but I particularly liked the way in which you have been able to, in your report, bring together unpaid work with violence, domestic violence, and the acceptance of that. And that made me wonder, just now, I think there's a seminar which is happening on wages for housework. Again, we are having those kind of, debates. And I was just wondering, that made me think like, wow, I mean, acceptance of violence and unpaid care work on the one hand, and wages for household on the other. So if you can make those connections, that would be great. And then for Lucia, my question was really about the spot calls. And I was wondering, on the one hand, I'm very attracted to it, particularly in the context of COVID, because now we can't see people, or just, the way Jayanthi described it was really intensive work that Jayanthi did in Sri Lanka. That sounds really good, but I'm a little bit concerned about two things. One is about constant interruption. So what do we do about time respect of people? And the reason why I developed this methodology with my colleague was when I wanted to do a time use survey in Delhi, and I came across a hurdle both at the top end and at the bottom end. So top end, because upper class women couldn't be bothered filling in a diary, because then it leads always the burden to the poor, right? So we can't do a cross-class analysis, and I wanted to do a cross-class analysis. And for the poorest, they didn't have any time. They were domestic workers. They went from one job to another. So I was just wondering about that. And also something that you said, which is physically really important, which is the lack of electricity and just the problems of charging your phone. So if you could say a little bit more about that, but I think that's a fascinating methodology, which I think we will be experimenting with, Jayanthi, won't we? Okay, So that's just me. I've got now questions coming up. Talia Kidder, along the line, so should I just read a couple more questions and then you can answer? We'll have a round, is that okay? Just shake your heads and Fiorella, is that all right? Okay, so I'll just, Talia says, along the lines of combining, anecdotally we hear from carers that multitasking and supervisory care increases stress. I would think that combining the accelerometer with a task recall that included supervisory call would give some better insights into intensity of unpaid work. So that's something for you to respond to. We've got also Julio Espinoza again. I wonder about the so what. How do these great pieces of research influence change in people's lives? At Oxfam, WeCare is using research data to run social media campaigns, but the linkages to changes in well-being of people are not clear. Sara Stevano, thanks, of course. I'd like to ask a question to Jayanthi in relation to how the notion of social reproduction is used in the Feminist Everyday Observatory Tool. Does social reproduction also include paid work? I'm thinking, for example, of the work of collective nannies that is normally paid, making it a bit of a simplification here. She writes, in Mozambique, or the practice of washing clothes for a neighbor or relative for a payment, again in the context of Mozambique. Did you come across any of this? And finally, Anam is saying two questions. Efforts around research uptake and any lessons learned on influencing national governments or public policy with these smaller scale studies. And the second is ethical and safeguarding considerations, spot phone calls, accelerometer devices, and how could you minimize these risks of violence against women, for instance. So I'll stop here, quite a lot for you to go through. I'll start with you, Fiorella, and then we'll go kind of in the opposite direction.
Sure, thank you. So I will start with your first question around sleep and the idea of recovery time. We are actually looking at this particular aspect in our project Depleted by Debt, which is a project that looks at the dynamic of social reproduction in the context of a high indebtedness. And accelerometry devices do allow us to capture sleep, and we triangulate the data from accelerometers with accounts of participants with lack of sleep, of sleeplessness because of various reasons, anxiety over not being able to pay back debts, etc. And then we also complement this more quantitative type of data with photo voice and in-depth interviews after the accelerometry package is completed. On the weather question, Giacomo Zanello and Professor Srinivasan are actually working on a new project that looks at relationship between work intensity and weather. The accelerometer device is able to capture light, so you can look at the correlation between increased energy expenditure, energy intensity, and increase of light. Clearly, the participants have to wear these accelerometers on their clothes and not under. And I don't know if there is time, maybe Giacomo or Professor Srinivasan want to say something about the technicalities about this new projects.
Does anyone want to come in on this? As Fiorella is saying? Okay, so then can we have Jayanthi and then of course Amber and Dia. Oh, and Lucia. Jayanthi, do you want to respond to Sarah?
Yes, I'm actually just trying to read Nancy's comment as well. is
sorry.
No, it's fine. I can't quite do it, but I think that there will be a follow-on from my point where I would direct people to Nancy's comment after my point. In terms of what we looked at in this study, this particular inclusive economy study, we were observing women's everyday paid and unpaid labour. Our focus was on the unpaid labour because we were mostly doing the observations in households. But I think that what our in-country research teams pointed out was that in the reality of those women's lives, those lines were very blurred, so they didn't differentiate between this is paid and this is unpaid. And I mentioned the example of the woman who was doing subsistence farming in the home and at the same time was packing mushrooms and selling them to the neighbours. And there were a couple of other examples there. Shirin mentioned a study that we're doing looking at the impact of COVID-19 on BAME carers. And I think that this FIOP method could be applied taking into account the limitations with the pandemic restrictions very, very usefully to understand how that paid and unpaid work, care work, happens in the lives of paid care workers, so who are going into people's homes, for example, doing care, while at the same time having to manage looking after their children at home when schools are shut down. I take on board, just looking very briefly at what Nancy's doing, because what Nancy's put, because I'm not very good at multitasking. I take on board that the risk of the kind of the conceptual slippage potentially of and the need to define social reproduction precisely. I think what we wanted to do was reflect the reality of people's lives. So we observed everything during that day, and then when we asked questions, because it was a narrative interview, we were led by what they focused on.
Thank you.
I wonder if I could just very quickly respond to, I think it was Julio's point about the advocacy and the so what point. I think it's a really important point, and one that we very much wanted to do, but didn't quite have the time and resource for the inclusive economy study, but are actively focusing on for the carers study that Shirin mentioned. And that is that the local communities with whom we carried out the research, the activists and the women's rights organizers really liked our study and were very keen for us to share that work, because it because it resonated, that the multidimensional awareness resonated with the participants, and there was a lot of potential, had we had the time and resource, to be able to put those findings into a sort of research brief that was accessible for those activists to then share with communities and start, talking points and keep discussions going. So.
Thank you. Lucia.
Hi. I don't know if you can see. Oh, you can see. Oh, yeah. Thanks, Shirin, for the question on electricity. I think it's a very good point. So how we did it is that my research assistant visited the families before the calls, and we gave them money as well to charge their phones, and they usually did it by some shop at the roadside. So that was okay, but it was a limitation because they weren't always charged. And the other point about the interruptions, that's also something we thought about a lot, and we decided on a certain time frame, like we wouldn't call after 8 p.m. or 7 p.m. And also we decided to keep the calls short, just 5 to 10 minutes per person, and only to call once a day. And I also emphasized before each call, I said, you don't need to pick up the calls if you don't want to be interrupted, to make that very clear. And I also thought I'd quickly talk about I think Lauren had a question about measuring children's time use, and that's something I've been thinking about a lot. So, and also about whether interviewing parents about their children's time use or interviewing children themselves. And actually for the research in Uganda, we used, so at that time, the household care survey only interviewed parents about their children's time use. Later on, we added a module on children, asking children themselves. And in Uganda, for my PhD, I also interviewed the children of the parents, and we found drastic differences in the reported time use. So especially for care work, which was actually the most interesting bit, is that I think it was something like 5 hours different, like mothers kind of underestimated their children's care work, which kind of speaks in favor of actually asking children themselves about their time use. And that's also what Oxfam's taken on with the household care survey, now including a module with interviewing children themselves.
I can see, thank you, Lucia. I can see a really interesting conversation developing in the chat about social reproduction. And I'm hoping that we can save this and also feed that into the resource that we are hoping to produce from this webinar. But I'm not sure whether we can have this. So Ale, thank you for your comment as well on social reproduction, and you say that in the global south there's a mismatch between unpaid gendered work and care, unpaid work, etc. So I'm not going to do that, but I'm going to go to Amber and Dia first before we start on a second round of questions, if we have.
Thanks, Shrin. Dia, did you want to pick up about violence and unpaid care work, and then I'll speak about government advocacy?
Yeah, thanks. So yeah, I think the question to address about violence and unpaid care work is about social norms. So for example, there was this landmark judgment passed by the, I forget whether it was the High Court or the Supreme Court, which said that this woman who died of an accident should be compensated by the insurance company for her unpaid labor. Now, first of all, that's a very middle-class concept. I mean, the poor are not really accessing the courts to begin with. And second, the question is that if you actually look into the directive that came from the court, this money was to be paid to her father-in-law. Because the husband and wife had both died, and the money was to be paid to the father-in-law of the woman. So, I mean, the questions of who owns the woman is still very patriarchal and sexist, and I mean, that's really the issue. And then, I mean, very anecdotal information, but during the lockdown, of course, what happened was a lot of the domestic helps were made to let go. And almost a year since the lockdown happened and then things kind of came back to normal, in several housing societies which are very middle class, you will actually find that they have never taken back these domestic workers again. Now, the interpretation that I'm trying to make out of talking to various people is that they actually see the women in the household as the substitute for these domestic help, and they see them as the primary care workers and who will do the work, and you don't need to actually outsource that and pay for that. You can actually get it done in-house. So I mean, I think there are a lot of complicated patriarchal norms which kind of are the subtext behind a lot of these things. So I mean, on the one hand, there is a landmark judgment, but at the same time, you see it's still kind of founded on very patriarchal understanding of who is the rightful legacy of that woman for, I mean, unless we address those issues, it's still, I don't think there's any advantage for the woman in this country. Thank you.
And then obviously the household care survey has been really important to give visibility to some of those dynamics that Dia just mentioned. And just briefly, if I may, I know we're almost at time around government advocacy and uptake. I think one key learning for us has been doing the household care survey to involve government departments and ministries at the outset of the survey, particularly national statistics departments, who are often very wary of any sort of NGO research. We've certainly found that to be really useful, and in the Philippines at the moment we're doing a large-scale study together with the Philippines Commission for Women and UN Women in multiple governance and districts, and having them on board has been really important for that. And I think also picking up a little bit on Nancy's point as well about the need for sort of further calibration or integration with national level surveys as well. I think certainly in contexts where those national time use surveys haven't been available or haven't yet been on track, we found having the household care survey at district level, representative at district level, has still been compelling for government officials to then be motivated to do a time use survey. And it was indeed, in fact, because in Kenya, when we had this household care survey, it really compelled the government then actually to invite us into the technical working group and ask for sort of advice around supervisory care. So it was really an entry point and inroads to say this is an issue across 4 different governorates in your country. Now let's do a national time use survey. Thanks.
Thank you, Amber. I mean, from what I'm seeing in the chat, it is that there's a real appetite for this discussion. And perhaps we can, Oxfam and WICID together, have, another session, another time, after we have reflected on and also taken on board Nancy's agenda for the future, and see if we can take this discussion forward. Alas, we don't have time for a second round of questions, but can I please thank everyone, the participants obviously for great discussion, but of course the panelists most of all for the wonderful presentations you gave and so really thought-provoking insights that Nancy put forward as well. And I just feel that there is a real opportunity here for us not to keep beavering away in our own little silos, but come together. And I want to in particular thank Anam Parvez, who is hosting this in the background, and she's done all the tech, and yes, and so watch this space, and we will be in touch again, and I think we should know who the people who attended today are, and if you don't mind, we'll reach out to you again if we plan another session on this. So thanks once again.